starting with my great friends and your former Governor and First Lady, Tom and Christy Vilsack, who are here. Another great friend of mine who has been active in Iowa and active on so many issues in Washington for so many years on your behalf is Ruth Harkin. Senator Tom Harkin's wife and great leader. I want to welcome the mayor, Mayor Perrell. Thank you very much for being here. Really appreciate your coming. I saw State Senator Stacey Apple come in. Thank you so much, Stacey, for coming. And in a few minutes, I'm going to introduce you to our very, very special guests who will talk about their own experiences concerning some of the issues that I want to raise today. So you'll be hearing in a moment from Pat Torpey and Mary Rose Brown, and I'm very happy that they are here because what they will talk about are issues that are affecting so many seniors and their families. But I want to start this morning by asking a few questions. How many of you are caring for an aging relative or know someone who is? Will you raise your hands? And how many of you have ever worried about whether Social Security and Medicare will still exist when your children and your grandchildren may need it? I think every hand went up on that one. How many of you do not want to be a burden on your children, either emotionally or financially, when you retire or if you've already retired? Yeah, lots of my mother's 88, and I can tell you that's how she feels. Now, I know that behind me we've got, ready to change and ready to lead. Well, I think we're ready for changes when it comes to helping take care of our seniors, but to recognize, as all the hands just did, that we're not talking only about issues that affect seniors. These are family issues. These are issues that affect all generations together. They're really American issues. And we've had in the past leaders who have called us as a nation to make smart choices about what needs to be done. Yesterday I was in Dubuque talking about some of the issues that I think are important in this campaign, and I mentioned that it was 72 years ago yesterday that President Roosevelt signed the Social Security Act. And when he signed the Social Security Act, he made it very clear that it was just a cornerstone and a structure that was being built, but was by no means complete. And certainly President Johnson, 30 years later, knew that we had to do something in order to help seniors who didn't have the resources as they age to be able to deal with the health problems that do come the older you get. You know that old story. I mean, the good news is that you wake up in the morning, and the good news is you know that because you hurt everywhere. And so I think everybody knows as we get a little older, things start to break down a little, and you need some more help. And so President Johnson recognized that, and when he signed the Medicare bill, he said, "No longer will this nation refuse the hand of justice to those who have given a lifetime of service and wisdom and labor to the progress of this progressive country." Well, I consider myself a modern progressive. I'm proud of all of the progress we've made as a nation, but it didn't happen by accident. It didn't happen by wishing for it. It happened because people came together and worked to achieve them, and sometimes over great odds, to reach what we saw as goals for our country. Well, today we face a new set of challenges, in part because of the very success of programs like Social Security and Medicare. The good news is we're living longer, and we're living healthier lives. But we still have to figure out how we're going to get our system to catch up with what is the reality of life today. Long-term costs already consume 40% of what we spend on Medicaid. And it's estimated that by 2040, that's going to grow by more than 250%. The average cost of a private room in a nursing home today is more than $70,000 a year. The average hourly rate for home health aides has gone up 13% over this past year. Medicare also faces significant financial challenges that are driven by the spiraling cost of health care. And unfortunately, we're not addressing any of these issues and planning for the future. Our current president hasn't called on us to make a national commitment to saving Social Security and Medicare. In fact, he's tried to privatize Social Security. And instead of focusing on Medicare, he has given tax cuts to billionaires and no-bid contracts to companies like Halliburton. And his answer to the prescription drug needs of our seniors is a plan that takes a PhD in bureaucracy to try to figure out. And as you'll hear in a minute, it's not working for a lot of people, Medicare Part D. Now, this is all consistent with how this president sees our country. He wants to leave everything up to the individual. He believes in the you're on your own society. And if you look at you're on your own, you take the first letters, that's the yo-yo society, where you go up and you go down and somebody else is pulling and holding the strings. Well, I think it's time that we talked about and confronted a lot of these issues, because for too many people, it's like they're invisible to the president. You know, we don't see what's happening in the lives of people here in Iowa and across the country from this White House. And I think that's outrageous, because so many people have worked hard their entire lives and they realize they can't afford to retire. I was in Las Vegas 2 days ago, and I was in a supermarket, and I was shaking hands with everybody working in the supermarket. And I met a man, and he looked to be elderly. He looked to be probably in his 80s, but he had a staff badge on. And so I greeted him and I said, "Now, are you working here?" He said, "I have to. I don't have enough money for my wife and me to live on." I said, "What do they have you do?" He said, "Well, you know, I kind of help around and greet people and try to guide people to where they need to go." He said, "But I don't know what I'd do if they didn't give me a job." In his 80s. If you're a senior who has diligently paid your long-term care insurance premiums for years, only to have the insurance company turn around and deny you benefits because of some technicality buried in the fine print of your policy, well, you're invisible too. And if you're a mother or father trying to raise both your children and care for aging relatives, you're at your wit's end trying to juggle it all, and you're invisible as well. And if you're that grandmother or grandfather struggling to make ends meet and heartsick at the thought of burdening your children and your grandchildren, it turns out you're invisible as well. Well, I want you to know that you're not invisible to me. And you're certainly not going to be invisible to the next president of the United States, because when we take back the White House, we're going to start seeing our fellow Americans again.